Hello, welcome to Wondermous, a healthcare leadership journey. My name is Merikay Hunt, and I'm your hostess for our episode today. And it's kind of exciting because today I have a guest that I met a few months ago at the MGMA, that's the Medical Group Managers Association Operations Conference in Charlotte, North Carolina. And Michael, why don't you introduce yourself and share with our audience how we met?
Hi, Mary Kay. Thank you for having me today. I've been an active member of the Medical Group Management Association for many years, and I was invited to facilitate two different workshops one the day before and one the day of. And I had attended some of the sponsor vendor booths, and we had a keynote speaker that was Mary Kay Hunt. And I like to sit towards the front of the room because it helps me to see better. And I randomly sat down at a table next to Mary Kay. Had never met her before, didn't know who she was, didn't even know she was the keynote because I wasn't really paying attention. And so I sat down and introduced myself to the person on the left and introduced myself to Mary Kay on the right. And she didn't say she was the keynote, and all of a sudden she got up and she walked to the front, and I was like, oh my goodness, I'm sitting next to the keynote speaker. And then we ended up connecting from there. So again, it's Mary Kay. It's great to be able to see another individual who's so passionate about providing providing people with the opportunity to be able to make a difference by taking care of patients and
Absolutely.
taking care of people. So again, it's a great opportunity, and I encourage anyone that's listening, don't be afraid. Don't be afraid to sit down and meet people because you never know what you're going to get.
Absolutely. And I have to share that I like to sit in front when I go to church, because if I sit in the back, I'm not going to pay attention. I'm going to sit there and make my grocery list and do other things.
We usually sit in the second row. Same thing, that we don't get distracted. And
exactly.
Yeah.
Well, and I was glad that we had a conversation that day, because that was actually the catalyst moment for you and I to have another conversation several weeks later, and which has led us here to today. So I think you have a very inspirational consulting journey in healthcare. So why don't you share a little bit about your career journey?
Happy to. Why don't I start out with I was born and raised in Chicago. I'm the youngest of five children in an Irish Catholic family. And when people say who are leaders that have most influenced you or helped you, I would say that it was my mom and my dad. My dad worked as a box office manager in the entertainment business in Chicago, and he worked with every single person imaginable, from the president of the United States to a housekeeper to a street vendor.
Wow.
And his philosophy was always, everyone's a VIP. Everyone's a VIP. And it doesn't make any difference what your title is or who you are. You all are a person that deserves respect and trust.
Yes.
And treat them all the same.
I love that.
And then my mother, she was a stay-at-home mom that did a lot of volunteer work and philanthropy. And when we would say something like, oh, Mom, my leg hurts today, and she'd say, oh, honey, I met with someone today that doesn't have a leg. And so I want you to be grateful. I want you to not go towards the negative and be grateful. And so that whole idea of everyone's a VIP and see gratitude in everything that you do, that influenced me to be able to say, I wanted to do something that was going to give me an opportunity to use those values or those qualities. Originally, I wanted to be a veterinarian. My grades weren't good enough. Then I went into physical therapy. Only 24 programs in the United States at the time. It was easier to get into medical school. Didn't get into physical therapy. So I ended up working for some nonprofits as a administrative assistant. And then as I looked at the opportunities that are out there, I said, I need to get some more education. I had an undergraduate degree in biology and psychology. And I said to myself, I need to get a master's in health administration. I was married at the time. I had two children. We owned a home. and we sold our house. My wife sold her business, and we moved to St. Louis, Missouri. Never been.
Wow.
We have a large family in Chicago. My wife's one of six. I'm one of five. We have lots of cousins and family members, and we took the plunge and said,
You got
we're
a
going to
leap of faith. Wow.
the leap of faith. So we went to St. Louis, Missouri, which had the oldest health administration program in the United States. I went to school full time. We put our kids in daycare. My wife worked full time, and that was my job.
Wow.
And my parents and her parents were like, this isn't necessarily a good idea. But we said, this is what we want to do. And it was the best decision we ever made. And
Mm,
so I share that, Mary Kay, because as we talk about our healthcare journey, it's not always linear. It doesn't always, you know, sometimes we write the book and the chapters in the book, and I say, we plan and God laughs.
mm,
And so it's the whole idea of you just don't know. And so can you pivot and can you move in a different direction? So I
mm,
ended up working with Trinity Health, which is a large Catholic health system, as an administrative fellow and then as a project manager.
mm-hmm.
Didn't Wanted to eventually lead people, so I ended up working at Beacon Health in South Bend, Indiana, managing physician practices and growing that from 5 practices to 35, and from um,
Wow.
two specialties to 19 specialties, and from having 20 employees to 450 employees.
Mm,
And I used to say, Mary Kay, that I was the highest paid medical receptionist in the county because I learned everything from the ground up. I knew how to
wow.
check a person in, how to check a person out. I knew how to be able to process medical records. And that gave me a wonderful opportunity to be able to say, how do you lead by example?
Absolutely.
And I learned as I advanced up. I ended up be, being recruited by Cleveland Clinic, a
Mm-hmm.
large health system, well renowned both internationally and nationally in both
Mm-hmm.
hospitals and health systems. And they asked me to run their management services organization, working with internal and external groups on how do you manage physician practices and how do you handle these various things. I worked with 12 different organizations with governance and leadership. And I was able to take all of that experience, Mary Kay, and move that to um, helping to recognize that change occurs at the pace of trust.
Mm. Oh, I got goosebumps when you said that. Look.
Change occurs at the pace of trust.
Yes.
And when you're working with 12 different organizations with different perspectives and different outcomes, and it's the whole idea of you can't go in there and say we're going to do a change. You've
Right.
got to develop the trust. You've got to develop the respect. You've got to listen to the
Yes.
work and listen to
Preach.
the people. And then as you develop the trust, to be able to plant the ideas and the suggestions and to say, what's your ultimate goal? That
Absolutely. Well,
that allowed me, Mary Kay, to move in. I had not managed hospitals before, so
mm,
Cleveland Clinic hired me to be a vice president of operations in ultimately 3 other hospitals. I had
wow.
never I had never done that, but again, the leadership I had shown in leading by example,
Sure.
leading by change of trust, it allowed me to be able to uh, become high performing organizations
Mm,
by developing those teams of people. And so
mm-hmm.
again, let's move on to another question, because again, some of the other things that I've done in my professional career have lent myself in terms of some of those premises of show gratitude,
Sure.
everyone's a VIP, leading by example,
Mm-hmm.
and recognizing that change occurs at the pace of trust.
Absolutely. And everything that you've shared, Michael, were stepping stones to the next section. And I want to rewind just a little bit. I wrote down Trinity Health and Beacon Health, and the expansion on each of these entities was huge. What was one of the biggest challenges in that expansion phase?
When I joined Trinity Health, it was actually called the Sisters of Mercy Health Corporation.
Okay.
And it was it was the oldest Catholic health system in the United States.
Mm-hmm.
So we had people from all over the world uh, in Catholic healthcare that would come to learn from us on what does system mean. You
Mm,
say you're a system, but what does it really mean?
right.
And so it gave me an opportunity to really see the independence of each of the hospitals, as well as what does it mean to integrate? What does it mean to have efficiencies and opportunities to be able to, the sisters used to say, no margin, no mission. And
Mm,
so, how do we make sure that while we have a preferential option to serve the poor, which was a very strong part, you
sure.
can't serve the poor if you don't make money to be able to serve the people that don't have any money.
Right.
And so
Right.
I'd say the biggest challenge was as I managed projects, I had the opportunity to work for one of the only system departments in the United States, which was uh, physician services, quality services,
Mm-hmm.
allied services, and nursing health services. And
Okay.
Mary Kay, I'm going to age myself because we did a blue ribbon panel in the late '80s, and we brought together experts and thought leaders from all over the world. And our blue ribbon panel was, and the recommendations were, it's important to involve physicians in the governance and the management of healthcare organizations. That
Mm,
was like
yes.
amazing. We look today and say, of course you're going to have physicians in the governance and management. We didn't have physicians that were vice president of medical affairs. We didn't have physicians serving on boards and governance
Right. Right.
committees. And so they were more of, we said they were a partner, but they really weren't. And
Mm-hmm.
so working with physicians from the beginning of my professional career really allowed me and helped me to be able to see that you can't accomplish anything in healthcare if you don't have a partnership with physicians, and how you can work with physicians differently than you work with other people to be
Mm-hmm.
able to, how can we create a wonderful patient experience? How can we make sure that we have great employee engagement? And how do we bring that trust and that respect in the work that we do?
And what was the best practice that you used, Michael, to build that bridge of communication with the physicians?
I'm going to say that when I was at Cleveland Clinic was known clinically as being a phenomenal clinical outcome. And the
Mm-hmm.
president at the time was Dr. Toby Cosgrove. And he was with Harvard MBA students talking to them. And one of the students said, Dr. Cosgrove, do you teach empathy? He says, what are you
Yes.
talking about? He
Mm-hmm.
says, what are you talking about?
Mm.
And she said, my dad needed heart surgery. And I looked at two places, Cleveland Clinic and Mayo Clinic,
Mm.
that both have great outcomes in heart surgery. But Mayo Clinic was way up here when it came to empathy and patient experience, and you were down here. And we
Wow.
chose Mayo Clinic. So that hit him really hard. And then the second thing that hit him really hard was he's a cardiothoracic surgeon. He he worked to many patients that aren't treated anywhere else can come to Cleveland Clinic as a last ditch resort, and he ended up saving this patient's life. And he saw the mother and the daughter a couple days later, expecting lots of accolades, and they said, "Dr. Cosgrove, we just want to let you know, while you saved her father's life, we will never come back here." And he's like,
Mm.
"What do you mean?" The nurses were rude and your facility was filthy. And
Wow.
those two experiences said, we've got to do something different.
Mm.
While we great clinically, we need to have a great patient experience. He hired the first patient experience officer in the United States.
Oh, fantastic.
And then we ended up measuring our patient experience and seeing that we wanted to be top tier. And how do we educate and train our providers and our staff to
Mm.
collaborate together to not only provide great quality, great
Mm.
outcomes, great patient experience. And so that major, and I'm not even say it's an initiative, a
Mm-hmm.
major culture shift
Shift. Yes.
on how are we going to act and behave differently
Mm.
in with our patients to be able to do it. Because again, our doctors were very doctor centric. We were employee centric. We were provider doctor centric. We weren't patient centric. And many organizations say that they're patient centric and they're not, because
Absolutely.
the decisions they make are very centered on the doctors and on the staff. And so having the opportunity to be provocative and to challenge and to be able to say, are you really patient centric? And to help people to have that gratitude and see that this is an opportunity to make a difference in the lives of the people that come that seek our help, and that we can do this through teamwork and through collaboration and through leading healthcare programs and services, service lines, and medical practices with best outcomes.
And it made me think of a story, Michael. My mom was diagnosed with pancreatic cancer 4 years after my father died of a rare protein disorder called amyloidosis. And she went to Duke, and her experience with this provider at Duke was horrible. He was rude to her. She started crying, and my mom was a tough cookie. And unfortunately, she elected not to try any surgical procedure because her experience was so horrible. And my former brother-in-law was an oncology pharmacist at Duke, and he kept trying to convince her, hey, look, he might not have the best bedside manner, but you need to pursue it. And I bring that up because when we think of patient experience, if someone's been diagnosed with a terminal illness or they lose a limb or, some sense of their, normal function is never going to be the same, they may never be satisfied. But if they have a provider and a care team, a 360 care team that's listening, that's compassionate, that's understanding, that's patient, that makes the experience. So thank you for highlighting that. And when you think about like a difference maker, a real change agent, what do you think is, if you look back on your career, what do you think is one thing that you are most proud of that you've contributed to the walk of healthcare?
I would say I've had the wonderful opportunity to be able to lead and to mentor and to coach incredible individuals
Mm,
that are moving forward and are serving in great leadership positions today.
wow.
And when they started, they may have lacked the confidence
Mm-hmm.
or the tools or the understanding of what it takes to be an effective leader.
Mm,
And so I'd say my greatest accomplishment is the opportunity to be an effective coach, a mentor, a teacher, and to
mm-hmm.
help individuals to think differently and to act differently in caring for patients. Because Mary Kay, if
Mm,
it wasn't for patients, none of us would have a job.
absolutely. For sure.
And they are the reason for why we're all involved in healthcare today.
Mm,
And not to forget that. And
mm-hmm.
so and that's where, when I was at Cleveland Clinic, they another culture shift was something called serving leadership.
Mm-hmm.
And that was a major mind shift for me, because what it taught me was 25% of our annual evaluation was based on how effective of a serving leader we were. Well,
Mm,
what does that mean? So I became a certified servant leader trainer and
mm,
teacher to be able to work with our staff and our providers to be able to show them how can we have a culture shift in
mhm,
being a servant leader. And
mm,
all of those qualities and abilities helped on, here's the toolkits that we can draw upon to be able to be an effective leader. So my role was, I'm not here to tell you what to do. I'm here to be able to break down the barriers that get in the way in you accomplishing the outcomes, the goals and objectives that we're here for.
I saw a beautiful story this morning on LinkedIn where a mother and her son were at a restaurant, and the son had cerebral palsy, and the photo was the waiter feeding the young man so that the mom's food wouldn't get cold. Talk about servant leadership. It can come in so many forms. So that also said to me that that organization believed in developing their people to take them to the next level, to impact not only the patient experience, but also the team experience. Because I really feel like when the team is getting along and collaborating and communicating and resolving conflict, that translates into better engagement, better performance, and also the patients benefit from it as well.
So often, Mary Kay, we as individuals wait for our organization to tell us what to do,
Mm,
as opposed to know what are the right things to be able to do with our
right.
teams. And as organizations go through a lot of transitions, they're waiting for, well, who's the new leader? What's the new strategy? And
Mm-hmm.
did anyone say while you're taking care of patients to stop for 1 year or 2 years to be able to do basically be complacent?
Mm,
No, it's we need to be courageous enough to be able to do the right things that are necessary for us to develop our staff and to
right.
develop and to work with our patients to be able to provide that experience. And and,
Absolutely.
and so that's where one of the things that I learned from early on was always raise your hand.
Mm,
Always raise your hand, always volunteer to be able to do something. So when I was at Trinity Health, when people would leave in my department and they they had to figure out how to do this, I always raised my hand and said, in addition to what I'm doing now, I'll serve as the interim to
mm,
keep things steady and to be able to help to move things along until you hire the permanent person. I didn't
mm,
want that position, but the
right.
things I learned by taking
Absolutely.
over the responsibility of those interim positions, that helped me to be able to learn and grow and help me in future positions to be able to see I never knew that I was going to need that knowledge or
Mm-hmm.
that skill. And so I always ended up being, I'm going to say, a jack of all trades,
Yeah,
a
absolutely.
generalist in that uh, I was the vice president of operations. I was the executive sponsor for the sustainability committee. I was the
Mm,
chief compliance official. I was the chief. I was the executive sponsor for community outreach. And again, those weren't things in my job description. Those were
sure.
things that I raised my hand and that thirst for learning, that thirst for being able to see how can all these different elements and pieces come together and just
Mm-hmm.
being comfortable with juggling multiple priorities and not just being so tunnel vision.
Mm,
One of the things that drives me crazy, Mary Kay, is when someone says, I'm just a medical receptionist.
yes.
I'm just a nurse practitioner.
Mm,
I'm just a supervisor or manager, and
mm,
that just drives me crazy because again, it's no one's just anything. You're in a
right.
position because you provide value. Well, I'm not a leader. What do you mean you're not a leader? I'm
Mm,
not a leader. I don't have a vice president title. You don't need a title to be a leader. And so again, it's the
absolutely.
whole idea of we as individuals demean ourselves and don't convey the positivity and wonderful contributions that we make in the roles that we have.
Mm,
And again, it's that being confident,
mm-hmm.
being hopeful, being resilient, and overall being a communicator of the work that you do and how you make a difference in whatever you do.
That's actually one of the things I share in my virtual professional development leadership course is everybody's a leader, no matter your position, no matter your title. We lead ourselves every single day. Inspiring. So, what are you doing now in your career walk? And I think you're based in California, correct?
I am in. I'm fortunate enough to live in Napa Valley.
Excellent. Excellent. So, are you fully retired or are you still consulting?
Um, I'm when I finished up my work at Robert Wood Johnson Barnabas Health Medical Group, which is in New Jersey, the largest academic medical center, as their interim chief operating officer. I was managing 360 practices in with 5,000 employees and 3,500 providers and every single specialty imaginable. And navigating decision making across 12 hospitals and the medical school at Rutgers and the multiple unions really required patience and diplomacy
Mm.
and a deep commitment to a
And
shared
sleep,
purpose.
a lot of sleep.
Yeah. And so I learned about the importance of aligned incentives, that we're all
Mm,
aligned, which we weren't. How do you build trust across diverse stakeholders, and how do you create structures for joint decision making?
mm,
And when I left that position, I continued. I live in California, continued providing consulting,
mm,
several NDAs that I can't speak about, but then some projects that I can in terms of helping organizations deal with changes, whether it's in a project, whether it's developing a compensation plan or working on a staff development plan, working on a strategic plan, and working overall in providing uh, work more on a part-time basis.
gotcha.
So
So
I'm
as
now a career transition coach for an
okay.
organization called Holden Associates. Been around for 35 years, and I work with individuals that have been severanced out of their organizations. A lot
Mm,
of people have lost their jobs in healthcare, and helping them to be able to reposition themselves and to find a new job. In healthcare consulting, I work with lots of different groups. And then I do a lot of nonprofit work here in Napa Valley.
well, that's
Um,
awesome.
I'm on the civil grand jury for Napa County. I'm on a area aging area an area a area aging in a center on aging for for two counties.
Mm-hmm.
I'm also involved in. I have a lot of work working on programs for the unhoused and the homeless. Um, Also working with developing philanthropy for some
Mm-hmm.
nonprofits. And so again, an opportunity to really, and on a local level, to be able to make a
Mm,
difference, and
yes,
and I've gotten actively involved in my community.
mm,
Separate from this, just as you saw me at the Medical Group Management Association, I continue to be actively involved in that group. I
yeah.
volunteered on the nominating committee. I'll be at the annual meeting in the end of September doing
And
two
you're speaking too,
presentations,
correct?
two times.
Okay.
Once with one of the MGMA board members on practical applications and use of AI in healthcare.
Okay.
And then another one on how do you rebrand yourself and present yourself in a way to be able to show the value you bring to organizations. You don't just
Excellent.
manage people. What did you do in managing people that resulted in positive outcomes? And then
Mm,
I'm also actively involved in the American College of Healthcare Executives. They have a mentorship program where I mentor early careerists. I also am involved in a senior executive engagement committee. And I love this, Mary Kay. We develop these, what we call dialogue and dinner programs. So
mm,
often you go to a meeting, you hear someone talk, people may ask a question, and you really don't engage with the people there. Our
sure.
dialogue and dinners is we meet at the senior leaders uh, hospital. We go to one of their conference rooms. We have a catered dinner. There's no more than 20 people. The
Mm-hmm.
leader shares their story for 10 minutes, and then
Nice.
everyone in the room has a chance to introduce themselves, say where they are, what's a question or a comment that they have. And ultimately, by the end, everyone has contributed and
Mm,
feels like they're part of a group that they didn't feel like they were part before. Because so
absolutely.
often we join organizations and we don't feel connected.
Right.
And so this is an opportunity where those people say, please offer more of these. I have one individual, we've done about 8 of these so far in 8 different counties. And this person's gone to all 8 of them because they see the value of this
Sure.
and the opportunity to really network, to hear people's leadership story, and then to be able to see how does that impact me to be a
Mm-hmm.
more effective leader moving forward?
Relationship building. And as we close our episode, one final question. If you could talk to your younger self and give your younger self some words of wisdom or encouragement, what would you say?
I tell my younger self to really embrace complexity early on
Mm,
and never shy away from hard assignments. The roles that stretched me the most, whether it was building new programs or integrating physician practices or leading large operational transformations, really became the foundation of my leadership identity. I remind myself, Mary Kay, that developing people is just as important as developing systems. And most of my meaningful achievements came from building high performing teams
hmm
and cultures of safety, engagement, as well as accountability. Uh,
I think that might
and-
have to be our title. Developing people is just as important as developing systems.
yeah.
So, Michael, how can people get in touch with you?
My email's pretty straightforward. It's Michael.O'Connell without the apostrophe 1981 at gmail.com.
Okay.
Michael.O'Connell 1981. Someone says, what's 1981? That's the year I married my wife of 45 years.
Oh,
And she's my best friend and the love of my life. But I wouldn't be able to do any of this if I didn't have her support. So again,
oh, that's
uh,
wonderful.
people are more than welcome to get in touch with me through email. And I'm also on LinkedIn as well.
Okay, excellent. Thank you, Michael, for your rich, rich stories. Again, my name is Merikay Hunt, founder of Coach MK Companies, helping leaders and their teams rise to next level performance. Please follow, like, and subscribe to our channel, and we look forward to the next episode of Wondermous, a healthcare leadership journey. Blessings and make every day count.